Good evening, staff. Today we're having a meeting to discuss our financial issues. Since the beginning of 2020, our facility has been dealing with the global pandemic, which is also known as the COVID-19. As many of you may know, the COVID-19 pandemic has caused some financial challenges in our facility. This pandemic has caused our hospital to lose millions of dollars. The hardest hit departments has been our outpatient department. Our outpatient department provides a number of services such as x-rays, blood work and lab work, MRIs, CT scans, and ultrasounds. At the beginning of this pandemic, in order to follow the federal guidelines, we were forced to cancel most, if not all, of our outpatient appointments. And also, our elective procedures have taken a hit during this pandemic because a lot of our outpatient surgeries were canceled or rescheduled for a later time, also due to the social distancing federal guidelines. This hospital not being able to do these procedures and perform these duties has caused us to lose revenue, and the revenue that's lost can potentially shut us down. We can only get paid for the services that we perform. Not being able to accept patients for outpatient services has decreased our revenue by at least 30%. We're also losing revenue through our payroll due to most of our staff working overtime to be able to care for our patients. And with most of our patients during this COVID-19 pandemic losing their jobs, which means that they're also losing their health insurance coverage. And they will not be able to pay for their hospital stays, which means we will be struggling to pay our staff and to pay our bills for the hospital, which includes rent, light, telephone bills, supplies for the hospital, the insurance, and etc. In order for us to increase the hospital revenues, I have developed a plan to help us succeed. And with that being said, unfortunately, we will have to lay off some of our hospital staffs. The layoffs will start with the closing of the hospital gift shop. During the pandemic, the gift shop was closed due to the hospital not allowing patients to have any outside visitors, so the gift shop will be closed permanently. We will also reevaluate supply costs such as the medications that we use to our patients during their stay. Instead of using name brand, we will opt to use generic drugs instead of the name brand drugs to help cut the cost. We also will be delaying payable accounts such as paying rent for the hospital and paying for the equipment that we receive, which will allow us to gain some of the revenue back. And any money that we will receive from the federal government, we will use to pay the bills and to pay off some of the equipment that was not on the delayed payment. And once we apply all these things that we have discussed, we should be right back on track to have revenue gain. And if anybody has any questions or concerns regarding anything that we talked about in this meeting, please feel free to ask me or send them in an email. Thank you for your time, staff. You guys have a good evening and have a nice day.